Have you ever noticed tiny, hard, white or yellowish bumps along your eyelid, especially near the lash line? These little spots can be surprising to find, and you might wonder what they are or if they're something to worry about. Many people discover them by accident while looking in the mirror or feeling a slight roughness when they touch their eyelid. These bumps are most often calcium deposits, also known as concretions. They're actually quite common, though not everyone is aware of them. Concretions are small, calcified collections of cells and mucus that get trapped under the conjunctiva, the thin, clear membrane lining the inside of your eyelids. Over time, these materials can harden and form tiny, pebble-like bumps. Although the name might sound alarming, concretions are harmless. They aren't caused by eating too much calcium or by any problems with your diet or overall calcium levels. In fact, they're not a sign of any serious health issue. Most people never even notice these bumps, and they don't cause any symptoms. However, if a concretion grows larger or develops a rough edge, you might start to feel like there's a grain of sand or a tiny pebble stuck in your eye, especially when you blink or rub your eyelid. This irritation can lead to frequent blinking, watery eyes, and a persistent feeling of discomfort. Sometimes, your eye may even become red or more sensitive to light. The real problem happens when these deposits start to rub against your cornea, the clear front surface of your eye. This can cause significant irritation and, in rare cases, even scratch the cornea, making your eye feel sore or gritty. The good news is that if these bumps ever bother you, they're easily treatable. An eye care professional can quickly and safely remove them in a simple, painless procedure, helping your eyes feel comfortable again. Why do these deposits form? Chronic eye irritation or inflammation is often the culprit. Over time, trapped debris mixes with calcium from your tears, slowly hardening into concretions. They're more common as we age, especially if you have conditions like meibomian gland dysfunction or chronic allergies. Long-term contact lens wearers and those with persistent eye inflammation are also at higher risk. Sometimes there's no clear cause. Some people are just more prone to them. The key point: these bumps are a local eye issue, not a sign of a bigger health problem. Most calcium deposits in the eye are harmless and often go completely unnoticed by the person who has them. These tiny buildups can form without causing any pain or vision changes, and many people never realize they're there. In fact, they're usually discovered during routine eye exams when an ophthalmologist spots them under magnification. However, if a deposit grows larger or breaks through the thin membrane called the conjunctiva, you might suddenly feel a scratchy, gritty sensation, almost as if there's a tiny pebble or grain of sand stuck in your eye. This irritation can quickly lead to redness, excessive watering, and even sensitivity to light, making everyday activities like reading, working on a computer, or driving much more uncomfortable than usual. In some cases, calcium deposits become visible as small white or yellowish bumps on the eyelid or the surface of the eye. While this is rare, it can be distressing, especially if the deposit is noticeable to others and affects your self-confidence or how you feel about your appearance. In more severe situations, a rough or sharp deposit can actually scratch the cornea, the clear protective layer at the front of your eye. This not only causes pain but also increases the risk of infection, which can threaten your vision if not treated promptly. That's why it's so important not to ignore persistent irritation, discomfort, or any changes in your eyes, no matter how minor they may seem at first. What might appear to be a small annoyance could actually develop into a more serious problem if left untreated, potentially affecting both your eye health and your confidence. If you notice any unusual symptoms or changes in your eyes, always seek a proper diagnosis from an eye care professional. Early attention can help protect your vision and your peace of mind. If a calcium deposit is bothering you, removal by an eye doctor is quick and safe. Never try to remove it yourself. Your eyelids and cornea are delicate and easily injured. The doctor examines your eye with a special microscope, confirms the diagnosis, and numbs your eye with drops. Using a fine, sterile tool, they gently lift out the deposit, usually in under a minute. You might feel slight pressure, but no pain. Afterward, you may get antibiotic drops to prevent infection. Most people feel immediate relief. While you can't always prevent calcium deposits from forming on your eyelids, there are many steps you can take at home to keep your eyelids healthy and comfortable. Practicing good eyelid hygiene every day helps reduce inflammation, irritation, and the risk of developing other eyelid problems. Use daily warm compresses to improve oil gland function, which can help prevent blockages and keep your eyelids feeling comfortable. After the compress, gently scrub your eyelids with a cleansing wipe or a solution of diluted baby shampoo to remove debris and bacteria. This simple routine keeps your eyelid margins clean, reduces the risk of infection, and helps maintain healthy, clear eyes. However, if you ever feel like there's something stuck in your eye, or if you experience persistent discomfort, don't ignore it. Watch for new symptoms like redness, pain, excessive watering, or sensitivity to light, as these can signal a more serious issue. Don't try to self-diagnose eyelid bumps or growths. These can have many different causes, some of which need medical attention. Only a trained eye care professional can accurately tell the difference and recommend the right treatment for you. Regular eye checkups are important, as they help catch problems early, often before you notice any symptoms. Remember, your eye health is worth protecting, and taking a few minutes each day can make a big difference. And if you do need treatment, rest assured it's safe, gentle, and can bring fast relief, helping you get back to seeing and feeling your best.